we're asking you about your childhood trauma.
Mm-hmm.
Weird. So how did you feel about that?
Uh-huh.
And essentially we gave them 2 options. And, the option was, thank you so much for asking, or get out of my business.
Yes. Mm-hmm.
And I usually will have our new hires guess. And I'm also talking about physicians in the room,
Sure.
clinical staff, but guess what percentage of folks do you think said thank you so much for asking? And usually the percentages are very low that they're guessing.
Uh-huh.
But in fact, over 94% of our patients said, thank you so much for asking.
Yeah.
It always gives me goosebumps every time I say that. But we had people sit on our couches and disclose histories of trauma for the first time. And they said things like, I didn't even know that what happened to me impacted my marriage or relationships or parenting. And then I always say that, many of them also said, well, I didn't know that what happened to me impacted me, but I wouldn't have used that as an excuse.
Sure.
So we had to pause and talk about the difference between accountability and blame.
Welcome back to Season 2 of the 217 podcast, presented by Decatur Earthmover Credit Union and hosted by me, Jess Younghouse. Thanks for listening and thanks for watching. We hope you enjoy it. Welcome back to the 217 podcast. Today I have Charmaine Robertson and Tanya Andricks from Crossing Healthcare joining us just to talk about Crossing and the great things they do in the community, and also talk a little bit about mental health today in the community and how that is impacting people here. So thank you for joining us. We really appreciate you being here.
Absolutely. Thanks so much for having us.
So first, why don't you tell me each what you guys do at Crossing and what your history is to Decatur.
Sure, I'll get started. Crossing Healthcare is what's called a federally qualified health center or a community health center. And we've been in the community for 50 years, providing comprehensive health care to people who might not otherwise have health care. And so we have a long-standing history, but people seem more familiar with us since we moved to our current location. We moved there in 2014, so we're on 320 East Central Avenue, and we have more of a campus. So we have substance use treatment facilities, which opened in 2019, and then our main health center, which opened there again in 2014.
Mm-hmm. Okay.
And so we provide health care, all ages, birth to death, and through partnerships with Decatur Memorial, we have radiology on site, and through partnerships with the Coleys, the Coley family, we have pharmacy on site.
Awesome.
We have dietitians, we have mental health providers. Really, we try to be a one-stop shop for primary health care for people who need our services.
Awesome. And so what do you do at Crossing, Charmaine?
Yes, so, Tammy's our CEO as well. Say that. Tammy's our CEO. I'm the Chief Behavioral Health Officer at Crossing Healthcare. So I get to oversee all of the behavioral health programming, which includes really dual diagnoses, both mental health disorders as well as substance use disorders. And our programs it's at our main clinic, as Tanya noted. We provide short-term solution-focused type therapy in that setting. Really, the goal is designed to be kind of like that in-the-moment support for life that's happening as we speak, and then to sort of help the person launch. One of the things I think our patients, know is should they need to come back, they're welcome to return.
Cool.
And then on our campus, or our substance use, sort of our recovery campus, kind of our recovery care campus, we provide both residential treatment services for both male, females, non-gender conforming individuals. We have recovery housing on our campus. There's activities for them. And we also still maintain a partnership with Macon County Jail with our Restore Renew program. So essentially our outpatient services happening while folks are at the Macon County Jail.
Okay, cool. So are you guys, I want to talk a little bit about how are you guys from Decatur, you guys personally, how did you make it here if you're not from here, and just kind of what are some things you love in general about the city?
Well, I'll start. So I moved to Mount Zion when I was 5 years old. My dad was transferred here for Archer Daniel Middling Company, so an ADM transfer. And so I grew up moved here in 1978, so you could do the math, when I was 5, and have lived in this community my entire life.
Okay.
Graduated from Mount Zion High School, went to Millikan and got a nursing degree, graduated from there, and went straight on to Decatur Memorial, where I practiced as a nurse in their emergency department, and then tracked my professional career administratively there. And 10 years ago, just this month, transitioned to this role at Crossing Healthcare, which was then CHIC Clinic, or Community Health Improvement Center. So that's what our official name is, and we do business now as Crossing Healthcare since we moved to the new location.
Cool.
So I have been here
a
good number of years, and have raised my kids here, and really appreciate this community a lot.
Okay, cool. Charmaine, what about you?
Story. So on the other hand, I am not a lifer necessarily. However, I am a lifer at Crossing. So I've been at Crossing literally for the duration of my time residing in Decatur. So I'm originally from from Chicago, Illinois. I have been in Decatur for almost 8 years, and at Crossing for almost 8 years. There were like multiple reasons, but family and all the things. I will say that the work that we do at Crossing has been a significant reason for my stay. I will say that. Like, there's a lot of value in that. And coming from a larger city to kind of see how the community really does come together and pull together, in difficult times, but then also just it's kind of the standard.
Yeah.
And I don't know that people see that always unless you have a different lens or have experienced something different. So that's certainly a part of my stick and stay.
What a blessing to have the place you work be a reason why you stay someplace, because not everybody can say that. There's probably not a lot of people that can say that, I would venture to say. Yeah. So how awesome for you. Okay. You told us about what Crossing is, kind of generally speaking. Let's talk about why you guys wanted to pursue roles in healthcare. What led you to that calling?
That's a good question, because I've had to rethink that over the years. I'm just going to be honest, I really was raised very traditionally by a very conservative family. And if I go back to my high school age self, I really had the notion that I needed to choose very gender conforming role for myself. And so for me, I thought I could be a nurse or maybe an accountant. Like, those were the things I thought were my future. I remember a guidance counselor saying to me, why don't you did good in school, you got good grades, said you thought about being a doctor. And I never really saw that as being an option. And I don't know why, because my current self now is I dream big and I shoot high, but my high school age self really didn't see those opportunities in front of me. So I knew I didn't want to sit behind a desk and that I like to be busy and moving. So I literally just chose nursing school for that reason. Now, it's the happiest accident that could have happened, and I'm grateful for that career path. But I really, looking back, didn't have that. No one was in my ear saying you could do anything or be anything. I don't know that ever crossed my mind. So I really chose nursing as sort of a default choice, that it seemed like it would work. Turns out it was a really good choice for me.
Yeah. I feel like nursing is one of those things that's not, you wouldn't call it hereditary, but a lot of times it is, lineal in your family, where if your mom's a nurse, you're a nurse, and so on and so forth. Teaching's kind of the same way. So did you have any background of nurses? I
had no nurse in my life. Literally, it was just, I felt like I wanted to go to Millikan because it was the only university I had exposure to. So I went to Mount Zion and I was in the show choir. So I'd been on Millikan's campus for show choir. So I really was one of those kids with a narrow perspective, hadn't seen a lot of things. And so that was the university I knew of. So that's where I decided I wanted to go. And then within their programs at the time, accounting or nursing made sense. And I chose nursing because I didn't want to sit behind a desk. Yeah. Like, I wish it was a different story, but that was truly where I was at.
Cool. All right. What about you, Charmaine?
Yeah, no, I think that's a great question. Actually, I'm going to say, well, I chose social work.
Okay.
I know that I chose healthcare right away. I didn't choose healthcare until I met Tanya and crossing healthcare, because prior to then, I had not worked in an FQHC, a federally qualified health center. But I do remember February 1st, 2016, Tanya meeting me and the other folks who started that day during orientation and talking about the mission and the vision and value statement. And that's stuck with me throughout my tenure here at Crossing. The sense of never turning anyone away based upon ability to pay, and serving everyone. And so I will say that resonated with me right away. And I think as a social worker, so by trade, I'm a licensed clinical social worker. And I'm going to say I felt compelled and drawn to social work probably because when you're in grad school, you learn about, ecological systems theory. And a part of that is this whole person and environment, the person being at the center and then all of these systems around them. And that stood out to me right away. I knew I wanted to work one-on-one and kind of be, a clinician, but I also wanted to understand the impact of larger systems on this one person.
Sure.
So as we're having conversations about stressors or increased anxiety or what have you, then we also have to zoom out and look at the educational system and the workforce system and healthcare systems. And so I'm going to say that really drew me to social work, and I'm sure that underpins a bit of why I was also attracted to Crossing. It was the only job I applied for in Decatur, and that was going to be that was my plan, and it worked out. And so I think that's a part of what drew me to this field.
Yeah. So how did it play out, your interest in healthcare or social work, your career path into administration? Is that something that you guys anticipated for yourselves? Is it, you said it wasn't really a goal to necessarily go into nursing as a young person, but once you started, is that kind of the pipeline you had for yourself, or how did it come to be?
So it's so interesting. Again, I'm going to date myself, but there was this George Clooney show on called ER back when I was in college. And so again, I thought that was just the coolest show. So I decided I want to be an ER nurse. And so that's where I went right out of college. I worked in Decatur Memorial's emergency department. And then the longer I worked in that department, the more I could see how decisions being made by leaders impacted the clinician's ability to provide care at the bedside. Sometimes in really positive ways, and sometimes in ways where I think that there were sort of unintended consequences of decisions that didn't always help patient care. And so after several years, I was really probably a little too self-assured, but decided I could do some of these things just as well as my leaders. And I thought, I need to do that. I want to help make decisions. And so I tracked administratively and had opportunities to do that at a very young age. By my mid-20s, I was directing the OB and Peds department. And so tracked administratively and did all of those things, and got to run the home care and hospice and durable medical equipment departments for DMH. Got a master's degree, and then 10 years ago, finally had the opportunity to leave that organization, which I love, and work in the health center, which really was a good way to marry my love of community with my passion for, nursing and trying to really bring the resources and make the kind of decisions that make it easier for clinicians to take good care of patients.
Sure.
So that's how that worked.
Cool.
Yeah, no, I think I was just enjoying listening to Tanya tell her story. So I think oftentimes many folks who go into the field of social work, back to that whole systems theory, where you're thinking of micro, meso, macro, right? And so we're either doing this individual work and or community, like grassroots work, or we're in policy or something to that nature. I don't know that it's always the thought process that I'm going to be the leader of all the behavioral health folks. But at the same time, I think it's been a path for a very, almost the onset of my my career in this field. I've worked in child welfare and community mental health, and for, POS agencies for the Department of Children and Family Services and all these things. But all the things there were multiple paths that led to leadership, even when I wasn't looking for them
Sure.
or really searching for them. There's some times where there's a good amount of value in being responsible for yourself. You're like, I can do this. I can control myself. I'm going to get her done. But then there's also a lot of value in teaming and
Sure.
kind of stepping back and working collectively. And so, again, that's probably one of the things that I noticed right away with in healthcare under Tanya's leadership and the leadership of our leadership team, is that we collaborate well with one
Sure.
another. And I've had experiences like that in other organizations. There's something unique about this organization and how we do that. And so, so the path and the trajectory went to leadership, but certainly it wasn't, it was something that I set out to do.
How does community public health, like Crossing, differ from a health system?
Sure, that's a really good question. So first and foremost, we are the recipients of a federal grant that is really the Macon County or Decatur Communities grant. So it's assigned to the region based on the needs of this region. And we have been getting that grant consistently through a competitive process since the 80s. And so our organization has held that grant since the 80s, and we hope to continue to do that, but we have to earn that every several years. And because of that, we're asked to seek out the needs of the community or do needs assessments. So know the people in the community and what their health needs are, and then design our programming and services to meet those needs. And so it's really very needs-based, and each community is unique. And so no health center looks the same across the country because each community is different. And so what you'll find is that we focus on sort of things like diabetes or things like pediatric care because there's more children, or things like mental health issues or substance use disorders. So we focus on the things that that we see the data support. Now, in our community, the data for health services or health needs is pretty hard to look at, because we as a community, if you compare our county to, say, the other 102 counties in the state of Illinois, on many health indicators, we're in the bottom quartile. And so we have higher rates of cardiovascular disease, higher rates of mental health issues, higher rates of substance use in our region. And so, we think we understand that, and we think we understand why, but, we have a sicker community. We have higher rates of cancer in our community. And so, the needs are great. And so our focus is how do we design our healthcare and bring enough healthcare to meet those needs. And so in that sense, it's based on a needs assessment. And that's very similar to health systems. They look at community needs and they try to do that. Where we differ is we try to make sure that we pay close attention to people on the margins. So people who might be uninsured, people who English might be a second language, or they may not have transportation, people who don't have transportation. And so we really look at the people who are going to have the most difficulty accessing those services to meet those particular needs. And so then when you zero down again, that's how you look at that. So we really try to bring healthcare to the people who would otherwise not get it.
What are the most used services at Crossing?
I really think they're all utilized
significantly
well. I think Tanya just said it best. It's integrated healthcare, right? And so many of us, when you go and see your primary care provider, we went to see our primary care provider, and that's it. Whereas, at Crossing, I kind of almost say it's like a little bit of a baby hospital in a way. So there's adult family practice, peds, prenatal, pharmacy, x-ray, lab, psychiatry, dietitians, behavioral health, specialty care and services. Also down to transportation barriers. And so, as Tanya just noted, part of our goal is to target individuals who may otherwise have multiple barriers to accessing healthcare. But the bus, pulls up right in front of our main clinic, things like that, things like those kind of barriers or things that can be barriers for folks that matters. Behavioral health is certainly utilized by folks in the community. You know, I think the benefit for me, I'll say, having worked in many other settings, is that I don't have to wait months to have a conversation with a psych provider or a medical provider about our mutual patient who we're serving, you know, in the middle.
Sure.
Kind of like you go down the hallway and you have a consultation, or we have an interdisciplinary team meeting where this person, again, back to the social worker part, person and environment, this person is at the center, and then how are we working to support them? And so, but in those instances, I'm talking about behavioral health, but we might be talking about SUD services as well. And the provider may be talking about psych services, and then the dietitian is chiming in and saying, yeah, I think they could benefit from, you know, services even with our garden, or we're going to check A1C levels and things to that nature. And so the holistic approach, I feel like it's something that we're really intentional about.
Right.
So for me, it's hard to pick one, because I think
I'm sure. And you don't get that. I mean, speaking from the experience of having a primary care, having an OB, all of these different healthcare providers for whatever different reason people have, it's very rare that all of their providers are able to sit down together and discuss a whole look at a person's healthcare and well-being.
It's important. I will say that we do a lot of pediatric care. And so we have a large pediatric set of physicians and providers. We take care of a lot of kids in the community. And, there's a vaccine for children program that's a state, it's actually through the CDC that provides vaccines for people who are low income or on Illinois Medicaid. And we're the largest downstate provider for vaccines for children in the state of Illinois, outside of St. Louis. And, we give, I think it's about just under $700,000 worth of vaccines annually through Crossing. There's just a significant amount of pediatrics. There's a significant amount of adult services. And right now we have a prenatal clinic. We have a partnership with SIU School of Medicine for OBs, and we have, 2 OB providers on our staff, and we have over 300 women who are pregnant in our care. Right now. So, to Charmaine's point, it's hard to pick out. There's a lot of healthcare that happens. On any given day, we have close to 250 appointments happen in our main clinic. So it's just, there's a lot of people coming and getting a lot of healthcare. With that said, I think my favorite part about it is that everything can be there. And so if somebody presents with a specific need, the provider that's in that exam room can walk out the door and touch a dietitian, touch a behavioral health provider, go ask somebody in the pharmacy a question, got Erica Coley down there, we can ask her a question, or they could seek consultation with someone else. And I think that having it all under one roof like that, brings a lot of benefit that's hard to put your finger on. It's just that synergies of connection that I think probably allows us to take really good care of our patients.
Yeah, absolutely. So let's talk about mental health at Crossing. How is mental health impacting the community today as you see it?
Yeah, that's a really great question. You're right. That is a big question, and yet it's a great question. You know what? I think the more the world has learned about adverse childhood experiences and trauma and the manifestation of high doses of trauma and the impact on our health over a course of a lifetime, I think the more the world has learned about that, the more we've done the responsible thing and stopped separating mental health from physical health. Right, because we're all one body, and human beings are already complex. But we know that they intersect. We know that they overlap. We know that one impacts the other. So when we talk about mental health impacting an individual, and then the ripple effect, what that looks like in the community, we're also talking about how mental health is also impacting their physical health, and or physical health is impacting their mental health. As well. Specifically regarding Crossing Healthcare, as Tanya noted earlier, we are intentional about screening. And so our goal is to screen individuals with various screening tools regarding their depression inventories and alcohol and substance use disorders, but then as well as suicidality and things to that nature. And the thing is, when you ask people questions, you got to be prepared for the answer.
Sure.
And we learned that, I think, back in, we've learned that, a long ago. But I'm going to say specifically with behavioral health, we started screening individuals, and we actually started doing this in a universal way throughout our clinic in 2017 with adverse childhood experiences surveys. And from those surveys, we got data, and the data said that the overwhelming majority of people had high doses of trauma. And we knew that to be true because when we go back to those original ACEs surveys, we saw that almost 70% of a population who was identified to be more affluent said, yes, at least one of those things have happened to me. At least one of those crappy things in childhood happened to me. Our patients, over 55% of them scored a 6 or more. Okay. And this was a small sample size back in 2017, but we knew that there was a call for us to do something about it. There was a physician here at the time and myself, and we joined the, kind of this like 9-month intensive training through SAMHSA and HRSA to become more trauma informed, specific, and responsive. And that was the goal. And not just for behavioral health. The goal was to have the conversation with all staff. Sure. Whether you are, behavioral health or a medical provider or the front desk staff, because we know they see a lot. They're the face. No matter our role, it was for it to not be foreign to have the conversations. Sure. Because while we're saying we're talking about our patients, we also know that we're even talking about us, even in this room. And so we started that process of screening. There's something really powerful about that, though. Outside of our patients having very high scores, we also gave them follow-up surveys to say, hey, like you came here for, I don't know, a flu shot or a wellness check, and we're asking you about your childhood trauma. Weird. So how did you feel about that? And essentially we gave them 2 options. And, the option was, thank you so much for asking or get out of my business. Yes. And I usually will have our new hires guess. And I'm also talking about physicians in the room, clinical staff, but guess what percentage of folks do you think said, thank you so much for asking? And usually the percentages are very low that they're guessing. But in fact, over 94% of our patients said, thank you so much for asking. Yeah. It always gives me goosebumps every time I say that. But we had people sit on our couches and disclose histories of trauma for the first time. And they said things like, I didn't even know that what happened to me impacted my marriage or relationships or parenting. And then I always say that, many of them also said, well, I didn't know that what happened to me impacted me, but I wouldn't have used that as an excuse. Sure. So we had to pause and talk about the difference between accountability and blame. Like, all right, there's somebody's job to take care of you when you were younger. And so most people can agree with that. But that was kind of the start for us. And so we make screening for trauma a routine part of our sessions, of our admissions, things to that nature.
And that's different than when you see a regular provider. You're not being asked about your mental health unless you're bringing it up, basically. Right. You're asking these questions up front, regardless of the reason for the visit, where at another provider, it would be up to me to bring that to my provider.
That's right. And while that makes us, in my mind, I'm like, oh, okay, maybe that makes us a little special. But it also means that when people say and ask, why are you asking me this? We better have a good answer because they're like, this doesn't happen. Why are you asking me these questions? And really what we know is it's going to help inform how we treat you as a patient, not how we treat you as a person. Sure. Understanding that a kiddo is presenting, Tanya talked about our population, significant peds population, absolutely. Understanding that a kiddo who's presenting and he has 5 on his ACEs score, 5 out of 10, and another kiddo has like a 1 or 2, maybe there is something related to ADHD with a kiddo who's got 1 or 2 and struggling with focus. But before we proceed forward with the labeling of the kiddo with a high trauma score, we probably need to zoom out and see what's going on in the home environment. Like we want to be responsible and say there are external factors that impacts, littles, and they don't necessarily have the language to communicate what that looks like.
Sure.
Adults sometimes don't have the language to communicate that, especially if no one has ever validated that what happened to them has impacted everything about them. So, and then how that impacts the community is that we either go out well or not. We're either practicing wellness, I think, or we're not. So I think that's a start.
Charmaine, just for people who might not be familiar with the 10 ACEs, do you mind giving an example of what some of those childhood traumas are so there's 10 questions. And so we talk about, you had 5 out of 10, but give an example of what some of those,
that's a good
screening questions are.
That's a good question. So some of those questions are prior to the age of 18 years old, were you often push, grab, slap, beat, hit so hard that it left marks or bruises? Was there sexual abuse in childhood? Did you grow up feeling loved, secure, belonging? Did this person grow up seeing their mother be physically abused? Was there untreated mental illness in the household, or anyone ever attempt suicide that the kiddo knew about and was aware of? Criminality, and I say that the question is anyone in my household went to jail or prison? But I would also expand that to say it's also just what was this person's first interaction with law enforcement? Yeah, that matters.
Sure,
I've walked kids back for a session and they've had strong opinions, right, on very small children. And our officers are super kind and intentional about meeting them and giving them a sticker and trying to change the impression. And I think it's important to hold space for this kid's interaction. Earliest recollection of law enforcement may have been taking my uncle away, or my dad away, and so loss versus gain, and being mindful of that. And then a very common question that lots of people can say yes to is, were your parents ever separated or divorced? Lots of people can say yes to that. So I always pause there and say, it's less about what we say yes to and more about how many things we say yes to. So the quantity there matters.
Sure.
But so I'm glad.
Is food insecurity? So food insecurity, poverty, those kinds of things. So again, 1 or 2, depending on those things, of those events, those adverse childhood events, may or may not have a large impact. But you can imagine if you have 5, 6, 7, what emotional and physical issues that you're dealing with. And again, reminder, how many of, what percentage of our patients have 5 or more? It's significant.
Yes.
Yeah. 6, is it? What's the percent? 55%.
6 or more.
So, and that's Jill Reedy from the Macon Pike Regional Education Office gave a presentation that I sat in on once that talked about the physical effects that has on a child's brain when you start to incur these adverse childhood experiences, and how that physically impacts the development of their brain.
Absolutely.
And so, I mean, that's just knowledge is power. Once you know that, and you can start, again, screening or being proactive about that, the only thing that can come of that is better.
It's true.
And our patients are surprisingly transparent about this, and moms are very transparent about this. These questions get asked in a pediatric department by a mom for her 3-year-old. It's not like the 3-year-old can answer these questions. And you would think that they would find the questions intrusive, but the truth is people want to be seen, and they want to share what's happening. Because they want to try to be good parents. Most of the time, people's intentions are to take good care of their kids. Yeah. We can all judge any way we want, but the truth is people are doing the best they can with what they have most of the time. And we find that to be the case in our pediatric department and throughout the clinic when we talk about these hard topics. And I think that we just do it.
That's right.
So before we talk about, I want to talk about what impact screening has had on your ability to
Resources,
treat and
Yes.
resources. But before we talk about that, I want to ask, how does it make you feel to work for an organization that is being so proactive and is able to really change the look and how people are being treated?
Yeah, well, I'm grateful. I'm humbled and grateful. I remember talking about the ACEs right away and talking to Tanya, right? I had the green light. I've never been given a yellow light or a pause. And from that conversation, we've been able to develop more education, programming. And by education, I also mean posters and flyers and literature and, all the things, ACEs, ask your provider about this, resilience, because I think the responsible thing to do is you don't talk about trauma without talking about resilience.
Sure.
There's lots of data and research about resilience, but it's a thing we try to wrap our minds around, right? Like, how could two people come from the same household and sometimes look at each other like, did we grow up in the same household? They have two very different, recollections regarding their experiences. But we also know that resilience, in order to be resilient, we've had to go through something, right?
Sure.
There's something that we have to sort of, quote unquote, bounce back from. But we have the conversation about resilience. I oftentimes share that there was an article I read like years ago. It was from a psychiatrist, and he talked about scoring a 10 out of 10 on the ACEs. He's like, any and everything you think could have happened to a person happened to me and then some. And then he said, but here's the thing, according to the data, I should be dead, because we know from the study of the 17,000 and a half group of folks that are still being studied to this day, and the study has been repeated over and over again, is that scoring a 6 or more shaves an average of 20 years off a person's life expectancy. We know that from the data, and yet he's like, here I am, I'm an MD, I've been married to the same person for over 20 years. What's the difference? And that's where resilience kicks in.
Sure.
Because we know that the number one protective factor is having a healthy attachment and relationship. And it's like, it's simple, and yet it's not always accessible.
Sure.
Like, folks don't have that necessarily. Right. But it makes sense. We're going to go through hard things, but do I at least have that one person? And it's nice to have like a group, and like a friend group. But the research says we only need one, and consistent, stable person. And that person might change, but at least one person. And that's what he attributed it to, is that I've always known that that I've had someone that I could reach out to, and they would be present, kind of in my darkest hour. So yeah, I think it's rewarding for sure.
Sure.
Yeah.
I think for me as the leader, it's important to make sure that we take the time to recognize how we can be different and be what a community needs, and then make sure that we stay true to that through the noise of things like pandemics and through the noise of things like, resources are less or more, or whatever the environment brings that month. At the end of the day, we have a mission statement, and we have guiding values and guiding principles, and it's not losing sight of those, because I do think that it's why you get up to do the hard things. Healthcare, education's hard. Lots of things are hard. Why do you still continue to do it? Because you feel like you're making a difference.
Sure.
And I think that that's finding that purpose as an individual, and then making sure we point out that purpose as a team to one another, so that we don't lose sight of it. And that's what we're trying to do. And it feels good when you're doing things like, addressing mental health issues, screening for them. But on the flip side of that, and one of the things we're talking about here is, when you screen, you find issues. And, after things like pandemics, where the mental health of the population has collectively slid, we all know that, we see it, we feel it, in the when you see the road rage, and when you're standing in line at the supermarket and you're looking around. Yeah, we see it. And so, we've continued to screen, we continue to do the right thing and find this, and yet we're overwhelmed by how much need we're finding, and we're sometimes overwhelmed and find ourselves like a triage, like we do in emergency rooms, of trying to get, because there's not enough resources for everyone, you know, and I think that's what the hard side of this.
Sure.
The beauty of addressing mental health on the front end with our population is just that, like all the things we've talked about. The other side of that is just, there's just not, like, if we could hire 5 more behavioral health professionals tomorrow, we would.
Yeah.
They're unicorns.
Yeah. So the lack of resources you feel on a daily basis.
Yes.
What is the trick to get more? Is it money? Is it that people don't want to do that? Don't want to have that career path for themselves? I mean, what's the...
Yeah.
It's all of it.
Yeah. Everything and then it all. Well, so before the trick, I don't know if I know the trick, but but we'll talk about that. I want to just kind of expound upon what Tanya talked about in terms of the need. So we know that this is not a Macon County issue. Like, I'm not even from Macon County, and maybe that helps, but this is not a Macon County issue. This is systemic, right? And so, truly, the need is great. So if everyone was to come forward, everyone who is experiencing some of those symptoms, or maybe there's something going on, or maybe it's not even a significant or, mental health diagnoses, but I'm there's adjustment related things, and I just need to process that. We know if everyone was to come forward, the need would be far greater than the resources. That's just a thing.
Sure.
The National Council of Mental Health, I was looking up stats with them, but it noted that 98 million Americans, 98 million Americans had to wait at least a week to be connected with mental health services. And for some people, we know that they don't have a week.
Yeah.
Like, we
know
that.
Doable.
I mean, for some people that's not doable. And in certain professions, it's very acceptable. It's like, oh, that's better than 3 months, right?
Right.
It's one of those things. And so to me, that there's a zoomed in approach of, when you screen, you open up Pandora's box. I will say that I think that was probably a part of the fear of some healthcare professionals. It's, once you ask, what if they say yes? I'm like, well, according to the data, they're going to say yes. And I'm going to tell you what it didn't mean, though. It didn't mean that we were making more DCFS hotline calls.
Sure.
Because I feel like that's the fear for many people. It's like, so then what's going to happen? Or are you going to take away my... Because oftentimes when people are talking about their trauma or what has happened, they're probably not talking about what happened last night. And that's a different conversation, and we would address it as such. But we're talking about, maybe chronic, long-standing, early and often trauma. So the need is great, and we know that. In terms of what resources are available, like how do you help kind of, fix the problem, so to speak? Well, I think the community is doing that by having therapists and counselors, though I think there's a big lane for a whole lot more. There's a huge lane for that, and we can talk about that as well. But it also reminds me of telehealth options as well, of online platforms. Again, additional research noting that while many Americans know about telehealth platforms, only about 7% of us utilize them. And that is like, wow,
That seems low.
That's pretty low, right? In terms of actually utilizing them. Now, I do think there's a lot of value in face-to-face discussions. And I think for some people, that's just preference, right? It's just like, I want to sit across from someone. And then for other people, I just need to talk to someone. Like, I need to talk to a clinician. And so we think about, kind of almost having a therapist in your pocket, so to speak.
Sure.
And so various telehealth platforms, crisis text lines, even though that's more in the moment support, but employee assistance programs, but also dispelling the myth, that your employers know that you have personally used the program. Your employers know how many staff use the program. You have to know that in order, right, to know if this is beneficial. But you don't know the who uses the program. But I will tell you that I know that is still like a myth, or there's just fear around, well, what happens if my employer knows?
Yeah, I have seen that firsthand before.
Yeah.
We have maybe this issue or something, whatever it is that you need to talk about, and we know this is available,
and people won't use it.
And we think that we won't, that we think that it's safe, but the risk of somebody finding out is still too great for us to overcome that barrier.
Right.
Sure.
Yeah.
There's a stigma.
Yep.
And it's true. I think that for us at Crossing, overcoming the fear of screening, because we also screen for depression. Anyone age 12 or up gets a two-question depression screen at every appointment. And so it triggers more referral to behavioral health than we can accommodate. Then we triage those. But what it does is, even if, say, the medical provider sees that patient, it triggers a referral. That referral gets made. Our providers understand the backlog. And so what they may do is call that patient back for frequent follow-ups, recognizing that while they're not the mental health professional, this didn't get triaged to an immediate, warm handoff. Because sometimes we go get somebody right now and bring them into the exam room, immediately address it. So it just we obviously triage those, but at least it allows us to know in the clinic so that we can leverage other resources. And sometimes that's a chaplain. Right. Sometimes the issue is grief. It's not, it's not a mental health diagnosis as much as it's a situational problem that we could leverage another member of the team. So we work really hard to try to leverage all of the members of the team. Again, recognizing we aren't always, it's sometimes, it's paralysis from analysis, or you don't do something because you want to do it perfect.
Yeah.
And we aren't doing this perfect, but we did not try.
Right.
We're trying. And again, if we could hire more staff tomorrow, we would. And I also think that, I would love to be able to pay people more. I think that's a piece to the puzzle. I would love to be able to, offer more benefits. I think that we try to stay, in the competitive side of things. The same with our physicians and our nurse practitioner salaries and our dietitians, everyone. It's hard, and yet at the same time, we also try to bring the other pieces to what work is about, and so we try to be the kind of leaders people want to work with. Charmaine tries to be that. I try to be that, and so we try to hit it from all angles. Recognizing we're not going to score a touchdown every time. That's what's hard. It's hard. And I think anyone listening to this, whether healthcare or a small business or anything, it's balancing, how do you recruit and retain the very best talent?
Right.
When, the brightest and the best can kind of pick what they want to do. So it's all of it. It's all of that.
Well, I do love, we know that company culture plays a huge role in attracting and retaining younger talent, and it sounds like at Crossing from you two that's being done, and just the work in the community that you do. Our conversation here today has shown that it's a good place to work.
We want it to be. We try for it to be, and we appreciate the opportunity to talk about it.
Sure. So if you could, I guess, speaking to finding employees and, coming off of a pandemic and what that looked like for healthcare workers, what that looks like today for the community mental health, like we've kind of touched on, what would you say to somebody that is kind of tinkering on pursuing a career in healthcare or in social work?
Well, so I'm a little biased, or I'll say that. I didn't browse much in terms of my educational path, but BSW, MSW, LCSW, all the SWs. So I think social work is a phenomenal field to choose. And again, there's so much work that you get to do in the field up close and personally, and or as a researcher, and or combination of the two. But one of the things that I do want to say that's important to note is, as a social worker, as an LCSW, you are a provider, right? And so working for a federally qualified health center does provide incentives. And so, for an example, I'm a recipient of the HRSA National National Service Corp loan forgiveness. And so working for, essentially it's saying we know that you're working with our, most maybe at need, population, highest need population. Here's how we want to kind of invest back and hope that you stay and continue to work with this population. And so getting a certain amount of funds towards your student loans for X amount of years of service, and not like a decade, but like 2 years or 3 years.
Sure.
But again, because I believe in this work, I don't know, my student loan service portion has been over years ago, and I'm still here.
Yeah.
Because it was far greater than that, and
Right.
yet at the same time, it was a huge incentive.
Yeah.
Right.
And we do know it's expensive. I mean,
Yes.
it's not a secret that it's expensive to
Yes.
go to school to be a social worker
Yes.
with
Yeah.
very little financial reward.
It's
Yes.
like
when
teaching.
you get into the field.
Yes.
It's
yeah.
like teaching.
It is like teaching.
Yeah.
Except I think our default, again, bias here, I think we think that we go teachers, right? I don't know that I don't always hear the language of social workers as well. So I think it's important to say that there are incentives,
Sure.
beyond the pay, for an example, and not just intrinsically.
Sure.
Yep, there's loan forgiveness. I would encourage, young women that, of course, you can be anything you want to be. And I wish somebody would have told me that, but maybe I don't, because I don't think I would have been happy with another career path. I love that I became a nurse. And I think that, whatever you choose to be, obviously, again, I'm very biased. I love the fact that every day is different. So working in a health center and in healthcare in general, every day is a new challenge because every patient's different.
Sure.
And it's the thing I loved the most about working in the emergency room. No one shift was ever like another. And that's super cool. I love that. And working at the health center is very much like that. So it's never boring. I talk to all new employees and I tell them that the work is, you're never going to get all the work done. So if you're one of those people who has to check everything off the list in order to feel like you can go home, then this might not be for you.
Sure.
With that said, you'll go home tired. It's hard, but you'll feel good about it. And so, I think that when you're choosing a career, nursing has a lot of benefits, like the intrinsic benefits, but it also has the value of you can reinvent your career. You can be lots of different things and head down lots of different paths. So obviously, if you're choosing nursing or social work, we'd love to talk to you at Crossing.
Yeah.
Yes, we will.
But I just would love to be supportive no matter where you go, because
Sure.
I think the world needs more caregivers. And so I'd love to support caregivers, whatever they choose.
Sure.
And we're just hoping to get a few of them at Crossing.
Yeah. Awesome. So tell me the address of your campus again, and where can people find you online?
320 East Central Avenue.
Okay.
320 East Central Avenue here in Decatur, Illinois. You folks can find us at www.crossinghealthcare.org.
Okay.
I add the G at the end. It's not the crossings. It's just crossinghealthcare.org.
We'll take it.
It's like
easy to
Earth Movers.
find.
Earth
Yeah.
Movers is not a thing. It's Earth Mover.
I know. We always want to add the extra
Make it
S.
plural.
We're Midwestern.
Yes.
You could head down Martin Luther King, headed north, and you'll see the campuses on your left, or you can head down 51 north, right through the business, 51 north through the business line there, and it's right on the right when you come over the overpass. So we're
good.
easy to see.
Yeah, awesome. Well, thank you guys so much for joining and just sharing a little bit of your stories personally, but also the story of Crossing.
Thank you for having us.
Thanks for the opportunity.
Yep.
Have a great day.
Jess. Make sure to like and follow Decatur Earth Mover Credit Union on our social channels for more content.